Welcome back, everybody. Brian Schwager here, founder of Wellness Movement Services, here to present Part 5B, my presentational series, An Integrated and Holistic Approach to Relieving Lower Back Pain. Thanks again for joining me today as we dive a little bit deeper into the physical stress component or the contributor to our lower back pain. Now, we've moved through the lifestyle-related factors such as emotional stress, biochemical stress, and nutritional stress. And I started out with those first three, like I do in my regular service. Those first three, meaning those first three stressors, or what I refer to in my service as the four principles. Just as a reminder, these four principles, they represent the four core pillars and foundation that leads to enhanced wellness and movement. And physical stress being the last contributor, or in my case here, or in this case here, physical health being the fourth principle. People usually think that's where we should start. And yes, if you have lower back pain, I agree that you have a physical challenge. But what got you there? What is making this presentation different than other pain relieving presentations or concepts is that I look at the body holistically and I empower you with knowledge. Yes, we have to understand that the body systems are interconnected and dependent upon one another to function. Yes, also the human body is a cybernetic, bioelectric, and magnetic organism, an integrated multidimensional system of systems. But going back to the multidimensional systems here, the emotional aspect. So how our nervous system is over innervated. Remember, we talked about the emotional components to that. And then your sleep, which really falls under your endocrine and hormonal system, and how you need to be in that good circadian rhythm in order to recover, repair, and restore your body from the injury. And then nutrition, well, that falls under digestive. Not alone, none of these are individual. Like I've always said, I don't look at the body in parts. Aristotle said the whole is greater than the sum of its parts. And by isolating parts, and like that's how Western medicine looks at the body. It carves you out into sections. So if all we did was look at your skeletal section and said, yes, you have a spinal condition, so we're going to just work on the muscles that support your skeleton, that's only part of the puzzle. But carving that out into sections never worked. That's why my clients, or other clients, people rather, end up working with holistic practitioners. Because the authentic holistic practitioner views the body this way, understands that in order to relieve pain, you have to look at more than one system. So digestive also plays a role in your pain, and what you eat also plays a role in your pain. So again, it's an integrated and holistic approach. We have to understand that in order for you to get out of pain and to stay out of pain, we need to address getting to the cause. There are a number of factors that are stressful to the body, right? There's heat, there's electromagnetic, there's emotional, spiritual, there's hormonal, there's digestive, and then there's physical. But what I'm saying here is an integrated approach is by combining and looking at all of them and then using a non-drug approach to helping the body to heal itself, which is how it's designed. It was always designed that way. but we were never taught how it really worked. Of course we didn't, because with all the advancements in technology and everything that I've mentioned in the previous parts, part 1, 2, and 3, why are we still seeing a rise in these statistics with lower back pain or neck pain? Knee replacements happening at a younger age than ever before. Why are we seeing all this? Well, this is why. Because we didn't really address the body the way it was designed, and that's its self-healing capabilities. By removing the interference, we can then calm the body down, because pain is chaos. Disease is, just as it says, not at ease. And all we're trying to do is bring you back into homeostasis, bring you back into balance. By integrating with other practitioners and creating a team approach. I talked about this and how I've used all of this with my clients, specifically between 2000 and currently, but I also use this approach when I went off on my own as a personal trainer in 1994, when I opened my very first company called the Mind Body Connection. Between 1994 and 2000, I collectively had about 20 different practitioners in the Milwaukee County area, geographically speaking, outside of Milwaukee County. But what I'm saying is that's when I started seeing long-term results for my clients. So here we are. So we have these stressors, and we know that the body communicates, and we know that these communications can have an effect on our cellular system, our hormonal system, and our bodies, our physical body. So when we're under a lot of stress, do muscles get tight? Right, they do. There's what they call that a tonic response. So we have all these stressors every day. And if we're not really addressing them in some way, shape, or form, which is what I promote in my service, is a holistic approach. Holistic with a W or an H. Holistic with a W means mind, body, spirit. Holistic with an H means I may refer you to an acupuncturist, a chiropractor, a myofascial therapist, or maybe somebody who works holistically in behavioral health, because we need to address the other mitigating factors. Going to a symptomatologist and working and carving out one section at a time, one body part at a time, only gives you short-term relief. But we have these physical stressors and these emotional stressors, rather. And these emotional stressors have a direct impact on the stabilization systems of our body. And all of these systems, like I said earlier, this is a multi-dimensional system of systems, and they all integrate together, that the organs talk to tissues, but the brain communicates with them all. Yes, we talked about breathing, and that's a great way to reduce your emotional stress, to take down the fight, flight, or freeze response, reduce the functioning overactiveness of your amygdala part of your brain, which is how we process fear and worry, where we process fear and worry. Not the only place, though. Remember, most of the processing is actually done in the heart. The brain recognizes it, but you feel it in the heart. But this breathing into your diaphragm helps to lower your sympathetic rate and raise your parasympathetic. Sympathetic is fight, flight, or freeze. Parasympathetic simply means you're resting and digesting. We need to get you into a recovery mode, and breathing helps with that. Breathing is the number one thing to keep you alive, isn't it? So the first two things I teach my clients is how to breathe correctly and how to drink adequate fluids. But also the diaphragm is a spine stabilizer. Not only does it pull you out of your position, now we're looking at physical stress here, aren't we? Breathing incorrectly induces changes on your physical structure. Now that's stressful, but it's also stressful to your biochemical system. Look at it, leads to hypoxia and hormonal imbalances. So correct breathing. And yes, it is a spine stabilizer. Yes, we need to sleep correctly. Why? Because at least 10 different hormones as well as neurotransmitters go sideways when you don't sleep. And just one night of missed sleep is sufficient to make you as insulin resistant as a diabetic. This is a good circadian rhythm. We talked about this. And here's where most people are at when they come and see me. Because remember, I rate all of these in my regular service. All of these are rated and ranked. So where are you on the wellness continuum? And then where are you rated? And the higher your rating is, the higher your physiological stress load is, and the decreased readiness for exercise, which will come in part 5C. We're going to talk about if you're in pain, your exercise protocol, because it's like medicine. I have to be very careful on how I dose out exercise because I do not want to cause side effects. So as your levels go up, your rating goes up, so your readiness for exercise goes down. So as the arrow goes up here in red, you have a decreased tolerance for, you know, complicated, integrated functional exercise. And your dream might be to get back to that. I hope it is. What is your physical dream? If you didn't have physical pain, what would you like to be doing right now? Would you like to be playing tennis? Would you like to be able to pick up your kids or your grandkids if you're of that age? Would you like to be able to work functionally outdoors, play golf, lift weights, run? Whatever it is, as you move up the level of difficulty of the exercise, you have to be able to have the tolerance. Your body's physiology has to be able to tolerate that. And one thing I've found in my practice is people get hurt while they're exercising because they haven't had their movement rated or their wellness rated. And this is a subjective look at your wellness. So we want to be able to get you out of this anabolic or catabolic rather. We want to get you into an anabolic response. This is anabolic. This means you're rebuilding. So 10 p.m. to 2 a.m. is when you're physically repairing. 2 a.m. and between 6 a.m. is when you're psychologically repairing. So neurotransmitters are doing their job to help to create more neuroplasticity and so you can think and react and go through your day without a foggy mind and forgetfulness and all those things that go with it. But here we're talking about pain. We're talking about the physical stress on the body, which is linked to the emotional stress, the biochemical stress, and the nutritional stress. Yes. How many of you right now have some sort of digestive disorder? How many of you are not aware that you do? I wasn't aware that I had it until I was about, I think it was 33, about 33 years old when I saw my first naturopathic physician. And that's when I discovered I had digestive issues. So these issues affect your ability to stabilize your spine. They're directly correlated with your spine. I covered this in part 3. If you look at that part of your back where your injury is, let's say it's in your lumbar spine, where your large intestine, your bladder, your kidneys, and your female or male organs are located in that area. So if those vertebrae are out of alignment, those are affecting the nerves that help those systems work. So now those systems are under distress. Or it could be the other way around. You could have constipation or irritable bowel, and that will affect, if you go up the ladder here, the small intestine, that will affect the stabilizers that help stabilize your spine. How many of you have had on and off low back pain for more than 3 months, for more than 6 months, for more than a year? Are they looking at these other characteristics? Are we changing your lifestyle? Or are we just treating the symptom? And what we're going to be getting into today is stability. Your spine isn't stable. If you have pain, you might have, or you probably, well, you might have some sort of a spinal condition. The level or the grade of the spinal condition is to be determined by the practitioner, the orthopedic, the physical therapist, or the chiropractor. But either way, we have to know. Because if I don't know what's going on, then I won't work with you. I'll get into that. But this is all having to do with nutrition. The association of visceral organ involvement and your spine and your muscles. Remember, they all talk to one another. So there is a significant association of visceral organ involvement in participants with nonspecific back pain. What does nonspecific mean? Meaning they can't figure you out. How many of you that are watching this are having a hard time going to different practitioners and they just can't figure out why your pain is there? Where is it coming from? So the most common visceral involvement in back pain was the stomach, followed by the small intestine, liver, colon, and kidneys. And they're all tied in. So we have to get to the crux of what's going on to get you out of pain, not just to treat the symptom. And yes, you can't build a house on a weak foundation, nor can you use cheap materials. If you use cheap materials, you're going to have a breakdown in your structure faster than you want. Now, if you're building a $1 million home, are you going to use cheap material? I don't think so. Well, your body's priceless. So if you're putting, polluted water in your body, and your body's made up of 75% water, and you need that water to transfer bioelectricity from your cells to your bones to your organs and etc. If your water is diluted and unstructured, you're not getting optimal work done at the cellular level. Remember, your bones are made of cells, your nerves are made of cells, your tissues are made of cells. You have over 75 trillion cells in your body. Well, my question is to you, are they floating in putrefied water? That isn't going to help. And we need to keep you hydrated. Your discs are full of water. And if you have anything like, any kind of arthritic changes, osteophytes, if those sound familiar, we know you're dehydrated. And then the other thing you need for tissues is the right fuel. So you can't put diesel fuel in a gas running engine. So you can't put processed foods and GMOs and sugars, grains and alcohol and bioengineered foods into a body that you're trying to build, in a body you're trying to repair. It just will not work long run. But I will say that, the processed foods, the sugar, grains, and alcohol, and fried and other denatured foods are one thing, but do not put GMO and bioengineered foods in your body at all, whether you have pain or not. That's another topic for another day. These will create suboptimal conditions and increase stress. Again, what we're talking about are the stressors to the body. We have these risk factors. Now we're going to get into the physical stressors. We talked about movement imbalances, movement restrictions rather. So if you look at number 5 here on my image, we talked about movement restrictions. Is one hamstring tighter than the other? Is one hip tighter than the other? Is one pec muscle tighter than the other, which will throw off your posture. So these are risk factors. And look at number 6. Relates to the first 3 stressors: emotional stress, biochemical stress, and nutritional stress. That's why I rate them. So if you look at the before scale, the wellness movement lifestyle rating scale, you can actually see that person had a high emotional health, biochemical health, and nutritional health rating, which affects their physical health. So unhealthy lifestyles have to be taken into consideration when someone has some sort of muscle joint pain, or what they refer to as musculoskeletal pain. So for these non-specific cases, or when people come to me and they've had on and off pain for years and years, then I show them this slide and I say, well, there are 10 risk factors that need to be taken into consideration. So this is why in a health history form, subjectively, I'll ask them, have you ever had any previous injuries? Then objectively, I need to look at them. I need to, look at their posture, look for these imbalances. I need to assess their range of motion and look for movement restrictions, number 5. And then, like I just covered, we they've since added unhealthy lifestyle risk factors to the 10 musculoskeletal health risk factors. And again, if you have pain, this is probably what was being missed. So now let's move our discussion into number 2, muscle imbalance syndromes, and start looking at these 3 common muscle imbalances that I look for when I do a physical assessment. So I'm going to be talking about the 3, and we're going to move into muscle imbalances because in 5A I already talked about restriction. So now we're going to get into muscle imbalance syndromes. So there are 3 common muscle imbalance syndromes that I look for. Now, this is just a side view. This is a very brief overview. This is a very deep topic. I want to make it real easy because you got low back pain, you got neck pain. So you got an upper cross syndrome if you got neck and back pain. Look at upper cross. That's the number 3. Now look at ideal. Now, I want to point something out to you that I am not about perfecting posture, sorry. Form needs to be ideal, but the word I want to use here, ladies and gentlemen, is ideal. Because most of my clients are type A, like I was, OCD, like I was, and this whole perfectionist thing runs us into getting into stress. Because the minute we don't see something the way we like it, now we're stressed out. Now we're back into a different cycle. Yes, we have to maintain our body. It's never going to be perfect, if you will. I'm always having to maintain my structural imbalances, but I am definitely living in an ideal functioning posture these last 35 years of my life. And Moshe Feldenkrais says ideal posture is the position from which the musculoskeletal system functions most efficiently. So your goal right off the bat is you got to be able to move through life. But like my motto says, my tagline is feel well, move well. But my motto is you have to feel well to move well, and you have to move well to move more. So again, we go back to your dream. What do you want to be able to do? But right off the bat, before you get back to the tennis court, lifting weights and running, you want to be able to pick up your kids, carry out a bag of garbage, maybe rake the lawn. Nobody rakes their lawn anymore. That's good exercise. Cleaning, bending, okay? You got to be able to do these primal patterns that you have to do to survive. How about getting in and out of a car? How many people is it painful for you to get up from a seated position or to get into a seated position? Can you get down on one knee and tie your shoe? Can you bend over and tie your shoe? There are 7 primal movement patterns that we need for everyday life. And one of them is lunging. You have to be able to lunge. You want to get down on one knee to tie your shoe. You have to be able to squat. You got to sit in the chair, sit on the commode, get in and out of a car. You have to be able to bend. Now, part of bending is squatting because you have to bend first and then sit. So you have to be able to bend over to pick up things, bend to squat. So you have to be able to bend. So we got 3. We have lunging, squatting, and bending. And then you have to be able to twist. So if you're backing out of a parking space and you're in a seated position, do you have to rotate your neck and your upper body to look behind you? You have to be able to twist. You have to twist to walk. There's a slight rotation in your trunk to walk. If your trunk doesn't rotate, you're not going to be able to really ambulate forward across the ground. Your trunk, by that slight rotation, creates motion. Yes, the practitioner Grakovinsky wrote the book The Spinal Engine. And for your body to be able to go forward or even backwards, you have to be able to rotate your trunk to create motion. So we need twisting. You want to be able to push. You push a grocery cart, you push a baby stroller, you're pushing furniture from one side of the room to the other, you're pushing weights if you're working out in the weight room. You have a push pattern. And then you got to be able to pull. So now you're pulling carts and things. the baby stroller, the lawnmower, if you have one of those. But you have to be able to pull things as well. And then there's gait. Now there are a variety of gaits. There's first of all, you have to be able to walk. And then for some of you, you want to learn to jog. And then for others, they want to learn to run and sprint. So there's our 7. So we have to lunge, squat, bend, push, pull, twist, and gait. Once we got that down, and we're doing it with ideal posture. Remember, he says ideal posture is the position from which the musculoskeletal system functions most efficiently. That has to be done unconsciously. So as you bend forward, as you squat, as you lunge, as you work with somebody that's coordinating your entire body and retraining your entire pattern, you're going to do that with good form. Now, this muscle imbalance syndrome, these 3 that I've chosen are the ones that I see the most. So number 1, we have people with a flat back, and they have a layered syndrome. Layered means that if you look at number 3, that's an upper cross syndrome. Well, this guy has an upper cross, and he's got multiple things going on. He's swayed forward in front of the plumb line. His back is losing its lower curve. Your back has a normal lower curve to it. See that? And your cervical has a normal curve to it. So you lost that curve. It's a little flatter. You're outside the baseline on the negative side. And then you have an increased curve in your upper middle back. So that was my posture. So I'm swayed forward, got a flat back, and now the neck situation is going to be different for everybody. And now once we discover if you're in pain, we got to go another step further. But once I take a look at your posture and I can qualify and say, yes, you have a flat back, swayed back, and an upper cross, now I can get specific on my corrective exercise or my corrective therapeutic exercise strategy. But there's one more thing. I'm going to cover that in a minute. Number 2 is a lower cross syndrome. Now let's go back to the upper cross, the flat back. I forgot to mention something here. Now with a flat back posture, the back is sort of flat. So think of this like a bucket. And if it's tilted this way, the water would be running out the back. Now, if you look at number 2 in the lower cross syndrome, now there's too much of an arch and the water's coming out the front. So a lower cross syndrome, the water's coming out the front. She's still pulled forward in front of the plumb line. Her head seems to be a lot further forward in an upper cross syndrome. So there's some things going on up there. So again, the corrective exercise strategy is different from the flat back. When we look at a flat back posture, usually the muscles in the front are short and tight. The muscles in the back are long and weak. It's not that simplified, but I'm going to keep it real simple for you. So if the muscles in the front are short and tight, do we have to loosen them? Yes. If they're long and weak in the back, do we have to strengthen them? Yes. Not for everybody, but again, I'm trying to keep this simple. Now the upper back is rounded. So those muscles across the pecs, the head's pulled forward. So in this image here, number 3, you can already see they're indicating this is a tight pectoralis muscles. So they're short and tight. The muscles are pulled forward. The muscles in the front of the neck are short and tight. And the muscles deep down inside the neck are turned off. That's what inhibited means. The muscles that attach your neck to your shoulders, your trapezius and your levator scapula, which attaches to the back of your skull up here, those are short and tight. So those have to be loosened. One side is going to be tighter than the other. That's the other thing I don't have an image of here. I covered that under movement restrictions. So if your chest is pulled forward, one of them is going to be more forward than the other. 9 out of 10 times, because you're rotating. Because there's not only a side posture I look at, there's also a front posture. So front view, or what we call an anterior view, as you can see in this image, he's got a low shoulder on the left. The image shows a high hip on the left, which is taking his spine out of alignment. His head kind of tilts to the right. Both of his shins seem to be rotated inward, and he has dropped arches bilaterally, or what we call pronated feet. The muscles in the upper back for both of these individuals are long and weak. Now for the second image here, lower cross, now with the flat back, they were long and weak in the back. Well, hers, she's got short and tight in the lower back. Short and tight muscles. And the front is long and weak. Again, the pecs are still tight. The scalenes or the muscles in front of the neck are short and tight. And then the trapezius and the levator, as I pointed to up here, those are short and tight. Very simplistic. There's a lot more going on here. Another thing that I find with that I find, this is what I was taught, is that my hamstrings are short and tight, which is another reason why my pelvis is tilting backwards and the water's falling out the back. For this posture, they're long and weak. The hamstrings are long and weak. But I've had people in this posture, like the young man I was working with that I showed in the previous part 5A, his were short and tight. But what we're taught classically or clinically, if you will, is for this posture where the water's coming out the front, the lower cross syndrome, they're long and weak. His were short and tight for another reason. Now, I didn't do a lot of stretching per se. We did a little myofascial work. I sent him to somebody to do that. And I did a little functional stretching for him a little bit. But the reasons his were tight were different. They were tight because of something else. All right. So it gets a little complicated. Again, when you take a holistic approach and you want to get to the reason why muscles are tight, yeah, we look at structure, right? So again, with the lower cross, long and weak in the front, short and tight in the back. Now her curve is excessive. There's a norm here. So for x-rays, we're looking at about 39 to 41 degrees if x-rays are taken. And if somebody's in pain, now when I work clinically, somebody would come in pain and the doc would do x-rays and the radiologist would measure. And the doc would say to the patient, like, let's see, for like the young man I'm working with now, but when we had the x-rays done here in Jacksonville, normal is 39 to 41. He had about a 44-degree curve. So his was too much. Okay, normal is 39 to 41. Now for the flat back posture, mine was a 36, so I was too flat. And again, I need to know this. So 39 to 41, I worked with somebody up in Asheville. They had a 47-degree curve in their low back. And they had a spinal condition to boot. We'll get to that in a minute. So what imbalances do we have? Now, I start with posture and then I look at movement restrictions. So if I'm looking at posture, now I can look at movement restrictions. And here, like this gentleman, the left lat was short and tight, the right one was long and weak. So his shoulder was dropped to the left because the muscles underneath here were pulling him down. So remember I was saying I had an image of the posture from the side. I have an image from the side, but when you look from the front, you can see his left shoulder is slightly lower than his right. I did find that his right hip was a little higher than his left, and his left hand, you can barely see the difference, but his left hand is rotated in more, which tells me that the left upper chest is tighter. And I later found all this out because I did a, comparative range of motion test to see if what I was observing here in his posture matched what I was seeing in his comparative range of motion test. and his right shoulder was hiked up because the trapezius was tighter on the right than it was on the left. So when you're in pain, if you're coming to me and I say, did they do x-rays? And they'll say, yeah, they did x-rays. I'll say, well, when were they taken? Well, they were taken about 13 months ago. Well, I need new ones because things have changed. So client tries all these different methods, had the x-rays back then, finds out who I am, comes to me, and I say, well, now I need updated x-rays because if you're still in pain, I need data. But if they said they had their x-rays taken 4 months ago, I said, well, can you get me a copy of those? Or they're saying, I'm in pain, I'm seeing a chiropractor, and I'll say, well, with your permission, can I contact the chiropractor and get his information on your x-rays? And then they allow me to do that through HIPAA. And then we have a nice conversation, the chiropractor and I. Now I got data. The chiropractor says, yeah, they had a 46-degree curve or a 45-degree curve. So they're 3 or 4 degrees forward. Again, the water's coming out the front. And I'm like, all right, that qualifies, or that measures up to what I seen in my posture assessment. Because I'm always checking my own work. When I worked in Asheville and I had my own facility after I left the clinic and opened my own place, I would get a client that wasn't a patient of the doc's, and then I would refer them to the doc because they'd come to me, oh, I got pain. And I'd say, oh, I'm going to refer you to my guy. And I'd call my friend and I'd say, listen, just check all my work. I got to make sure it's right. See, I'm not, that's the way I work. I want to, if I'm wrong, I need to know, because I'm not going to go forward with that client trying to guess my way through it, because that's probably what got her there, got them there, right? What do I mean by that? Well, if you're coming to me and you've had pain on and off for 3 years like that young man did, I got to find out what they missed. Because he made a decision to work with me as a full-time wellness movement client. He didn't want to get patched up. He tried that. So then I had to send him over to get x-rays and to rule out major spinal conditions. Because again, you're asking yourself, you have to ask yourself, if you're watching this and you have pain and you've had pain on and off for a while, or maybe you had it acute for a while, I hope not, isn't it time to nip this thing in the bud? Isn't it time for that? That's what I'm explaining here. By looking at this posture the way we're looking at this, and if needed, by looking at x-rays. Now I got your posture, I have your range of motion. The left hamstring's tighter than the other, the left hip doesn't rotate as far as the other, the left piriformis muscle, which is located underneath your gluteal muscle, is tighter than the right. The left pec is tighter than the right. I got all my information. Now my job is to unwind your entire body. So I think this would be a good time to interject this love-it-brother relationship, as above, so below. And the cervical spine communicates with the lumbar spine. The concept of love-it-brother spinal relationships, which describes the interconnectedness and reciprocal movement patterns between specific vertebrae, was primarily introduced by Dr. Robert W. Lovett, an American orthopedic surgeon. Now, it's interesting to note that this was discovered more than 100 years ago, and it suggests that dysfunctions in one area of the spine can be reflected in other areas, notably between the cervical and lumbar regions, as shown in this image. The lines are drawn from the cervical vertebrae right down to the lumbar vertebrae. So everybody talks to one another all the way down. So if I have imbalances in my outer core, right, one shoulder's higher than the other, one hip is higher than the other, my Shins might be rotated. My feet might be pronated or flat. You see that? There's a tilt, stress, pain. If you're coming to me with lower back pain, you have lower back lumbar spine number 1, 2, 3, 4 segments rather, or spine 1, 2, 3, 4, and 5. Each one of those individually talk to one of the cervical vertebrae. So L5 talks to S1. Now, the little line that's drawn here that connects L5 to S1, or vice versa, because there also could be a misalignment at the top, which could create a misalignment at the bottom. But think of that line like a telephone wire, if you will. So there's communication between the top and the bottom. Remember, your body's a cybernetic, bioelectric, magnetic organism. There is voltage and there is electricity that is traveling through the spinal cord and communicates all the way down into everything in your muscles, your organs, and whatnot. But the point I'm trying to draw here is that you come to me with lower back pain, and I'm assessing your entire body. So I'm looking at your posture from top to bottom. So let's go to this other image over here. And I see that you have a head tilt to the right, your shoulders low on the left, and you have a hiked hip on the left. And then you have some other things going on here as well, because as above, so below. But the point I'm drawing here is I looked at your posture. Now I have an idea where the muscle imbalances are. Then I can identify them specifically and find out which muscles are short and tight. So as an example, on the right side of your neck, your upper trapezius muscles and such will be short and tight in this posture. And the muscles that run alongside of your back, the backside, are short and tight because the hip is elevated on the left. These are just examples. So the person says to me, well, I have pain in my low back. Why are we looking at the neck? And I say, well, the site of your pain is not always the cause of the problem. And in addition to that, I have to look at the other parts of the body for other misalignments and imbalances. And I refer to that as taking a regional interdependence look at impairment. So we go back to this slide and we look at the impairments in one area of the body can affect movement and function in another seemingly unrelated area. Right? The body only recognizes movements by way of patterns, not just individual muscles. And that's why we're not just looking at your low back. And that's why this approach that I facilitate in my practice, this is why I do that. And it's how it's worked. And then I'll get out this slide a lot of times when I'm consulting, doing a consultation after their assessment, or I may have shown this during their initial consultation to give them an idea when they come in to see me. I'm going to be looking at everything, and I need to know everything. So if your cervical vertebrae is out of alignment because you have low back pain, I need to know that, and we need to address that. That can't be left on the table, if you will. And vice versa. If somebody comes to me with a cervical issue, I'm looking at their pelvis misalignment down below because they're all communicating. This column, when one part of the column shifts, the other part will compensate. That's why I look at the entire body, correct the whole pattern. Movements beginning and ending in poor posture foster injury. Posture reflects our foundation, our base, and has the most profound influence over the way we move. Poor posture compromises human function and is responsible for faulty movement patterns, which eventually lead to pain and/or injury. Posture will enhance performance and reduce the likelihood of injuries. Then we got to rule out spinal conditions. So I sent that young man to the chiropractor and got his permission to talk to the chiropractor and sat there and looked at the x-rays with him, and I had to rule out, does he have a spinal condition? Because that changes the corrective therapeutic exercise strategy. So do you have a bulging disc? Do you have a herniated disc? Do you have scamoral hernia? Are any of these other unusually pronounced names are arthritic changes? You know, the more that I see on an x-ray, so if I look at osteophytes and I see a spondylosis, so the space between, so let's say this is a vertebrae, and the empty space in between is your disc. Well, it's decreasing. So it's decreasing. And then there's osteophytes, and then there's arthritic changes. That's telling me that that damage has been there a long time, plus there's nutritional imbalances going on as well. That's what that tells me. That's been there a while. Somebody comes in with a slippage in their disc. Look at the misalignment here. That instability's been there a while. The muscles that are supposed to stabilize their spine have been turned off a long time. But I went to all these different people, Brian, and I did core exercises and etc. I said, yeah, you splinted it pretty good. You put a Band-Aid on it. It's like using the metaphor of a crutch. You crutched it pretty good. You took your pain relievers, it got better. You went back to your whatever you were doing, and it came back. Because the infrastructure, so your spinal, so you have your spinal column, right? And you see this little cord up here? It goes right through here. What's that called? Your spinal cord. That's your information highway. So if you have an Ethernet, remember Ethernets with the computer? Remember those? Plug it into the back of your computer, plug it into your modem. That's your Ethernet. And what comes through your Ethernet? Everything. Okay? Multimodem. You do not want to encroach on that Ethernet. So if I took a 200-pound object and I dropped it on your Ethernet cable, what are the chances I'm going to disrupt the communication that runs through that line? Or if I crimped it, right? So if that disc starts to move, or you have a herniation, and that's encroaching on, see, the herniation goes through, and that's encroaching on that disc, or that spinal cord rather, you got pain. So where's your pain? It's right there in my back. Well, I'm glad it's local, because my sciatica, my pain went through my butt, down the back of my leg into my toes. So the further down it goes, the worse it is. But what I'm getting to here is spinal conditions. So you have pain. Do you have spondylosis, a spondylothesis? Do you have an instability? Do you have tingling in your toes? Do you have are your feet cold and wet? Do you have weakness in one leg more than the other, or your legs just feel heavy? All right. So you come to me and you say, I got lower back pain. It's in your lower back. Good. And I'm going to say, well, who did you see? And I went to a physical therapist or an orthopedic or a chiropractor. What was your diagnosis? What did they tell you you had? And, you may say bulging disc. You may say whatever. And then, the more information I have, then I can start, in my mind, I can start laying out the outline for the corrective therapeutic strategy. This is your segmental area here. If that disc is moving, if that vertebrae rather is moving, the muscles that support that are not doing their job. And I need to get them to do their job. So this is your infrastructure. That's your priority. You got to protect that spinal cord. You want no damage to that spinal cord because you don't want it, you know what that'll cause, right? Numbness, tingling, loss of sensation, right? So we have some infrastructure work to do. And if that has been there, if you've had this acute or a chronic pain for a long time, those inner muscles, you know, your muscles are like software and your brain is like a CPU. So a computer, right? So if I need muscles to reflex, so let's say this is my spine and these are the stabilizers. They need to reflex when I'm moving so that my spine, when I'm moving, is protected because I may still have to bend, I may still have to twist, and I may have to go to side or go up and down, but I want stability where it's needed. No, I don't want to splint you and walk around like a mummy. Like, oh, I got to have perfect core and I can't be able to move because I got to have my core on. That's all a misconception. I'm going to lift the veil of misconception when it comes to core training. But what I'm talking about here is your infrastructure. If you've been in pain, your infrastructure has been sacrificed. And just to reiterate something here, this is what we're taught in school. Incidence of disc injury. What does symptomatic mean? It means you got symptoms. What does asymptomatic mean? It means you don't have symptoms. Now, here's a research study that was done back in 1995, and that showed that 76% of the people that were asymptomatic had disc bulges based on MRI scans. So what they did is they took people that had signs and symptoms of a disc injury and did MRI scans, and yes, they did find that 97% of them had a disc injury. So then what they did is they matched those people with age, sex, and activity levels matched to the control group. So as an example, they would match, let's say, a 35-year-old recreational athlete that has a sedentary job with pain with the same 35-year-old recreational athlete that has a sedentary job without pain. And they did an MRI scan on the one with no pain, and they did this in the study. They did this for about 50 people, and they found that 76% of the asymptomatic group had a disc bulge. Now, the importance of interjecting this here is, yes, this presentation is for those with pain, but I want to remind everybody, just because you don't have pain doesn't mean you aren't falling into the 76%, and this is showing the importance of getting physically assessed and having a comprehensive health history done before starting any activity. Oh yeah, then there's the scoliosis and there's the short leg question I get. All right, so the doctor says my right leg is shorter than my left. Well, unless you were born with it, unless you were clinically measured by a professional, or there were x-rays of your femurs right to left and they measured them and they actually are shorter, then you don't have a short leg. You have a rotated hip. So the cases that I saw, I had two in the 9 years I worked clinical where it was actually a short femur. So we had to put a lift. I think it was like a 3 millimeter lift in one shoe. And then I had to come up with a specific corrective exercise strategy. Scoliosis, same thing. You know, if you're born with it, it's not much we can do. I've had a couple clients that were born with it. They had it for a long period of time. It was better over time when I got my hands on them and with my chiropractor's help. It didn't get worse as they got older because I was working with a female who came to me with pretty bad scoliosis, and she was my client for 12 years. and it got better. But she still had, a little scoliosis. Um, so that's a kind of a deep topic, but I will say, it's a workaround. If you got it, you got it. And just know that with the right practitioner using an integrated approach, there's a lot we can do with that. You can still go out and play tennis and have a good time. But if it's not being properly maintained, you're going to end up with some real arthritic challenges and musculoskeletal challenges. All right, so now we got to talk about stabilizing your spine. So, do you need core strengthening or stability? Well, let's first understand the difference. Core strength refers to the ability to produce force throughout a given movement. So, in this case, I'm going to make a change here midstream with spinal movement. So this is a good example of core strengthening because what I have to do is I got to use my gross stabilizers, which are your outer core, in order to move from point A to point B. So this would be core strengthening. Okay, so that still strengthens your core, but that's with motion. And if you're coming to me in pain, you're kind of limited, aren't you? We're going to talk about this. And this is without spinal movement. So core stability refers to the ability to resist unwanted movement without spinal movement. So in this corrective therapeutic exercise, I'm having my client lower her heel to the floor without letting her back come up off the towel roll. Now the towel roll is there as biofeedback. When I did her assessment and we did her x-rays, her lower back curve was a little bit too much, so I need to take some of that curve out. So she's applying light pressure on that towel roll, using her inner core, lowering her foot without moving her back. I refer to that as hip low back disassociation. And if you're wondering what the tubing or the resistance is there for, that's for the postural muscles between her shoulder blades and her cervical. I was advancing her exercise that day and increasing the level of difficulty. I will go into more detail regarding corrective therapeutic exercise when I get to the part where I will spend time talking about movement as medicine. Now, if you have pain in your back, you need less core strengthening. So now we're going to get into the whole misconception about the core. I've done all these core exercises. I do planks. I do all these exercises. Nothing wrong with those. I think they're overprescribed. Number one. Number two, did you get your core assessed? Specifically, the inner core needs to be assessed. Now, if you're not assessing, you're guessing. So don't guess, get assessed. And after assessing hundreds of people, both clinically and privately, I have found that the majority of the people, their inner core wasn't functioning for various reasons. Their outer core was over-functioning. So in these two images, the top image, I'm actually using a pressurized device, and the little gauge helps me to see how the core is functioning. In the bottom image, I'm using my hands as biofeedback as she's lifting and lowering her heel. As I explained in the previous video footage, is her lower back moving, and is her core staying on? Her inner core, is it staying active? Now, going back to assessing the inner core function using the device, what I do is I have someone lie down with their belly button over that little blue cushion. Then I pump that up to a certain milliliter of pressure, and then I ask the client to visualize while they are actively lifting. So they're visualizing themselves lifting their belly button up off that little blue pressurized pillow. And then I'm looking to see how far the needle moves in one direction or the other. So if the needle moves too far in one direction, that's telling me that their outer core, their abdominals, obliques, etc., is overworking. If it's not moving hardly at all, the inner core isn't functioning. And if their back is moving and their shoulders are moving, that's showing me that they're compensating while they're doing it. Now I assess other inner core muscles like the diaphragm, which I covered in part 1 and part 2. And did you know that there are outer and inner core muscles? I'll cover this later in the video to follow. But the point I'm saying here is, was it assessed? Your outer core does support your spine, but indirectly. It's like your growth stabilizer. It's your secondary stabilization system. And that's for the outer. We're going to talk about there's a difference between an outer and an inner. Remember where I use the term infrastructure? We want to go right to where the problem is. So those muscles are different than the outer core. So you need more infrastructure work. You need to isolate before you integrate and create what we call segmental stability. So each vertebrae, and we have a vertebrae, a disc, a vertebrae, a disc, that's a segment. And let's say this segment down here is loosey-goosey. So there's slippage, or you have a herniation. That segment, most likely, if you have lower back pain, you might have mid-back pain, you might have neck pain, okay? But you need segmental stability all the way up the chain, because I'm just not going to stabilize your low back, because I guarantee you, just because you got pain down here doesn't mean we don't have dysfunction at the top. Remember the young man I was working with? Infrastructure, intra stability has to happen first before the outer stability happens. But when I assess people's core, their inner core is turned off, it's inhibited, and their outer core is overdominant. So if you have low back pain, do you think your muscles around your waist are going to get tight to protect your back? Yeah. Your brain and your body is built beautifully. It has a survival mechanism. It's called tonic to protect you. So it splints you, because the inner muscles that are supposed to segmentally stabilize you, we're going to get into this, they're turned off. So the brain is sending a message to your obliques, your rectus abdominis, and your lats and your rector spinae to splint. So when I assess somebody's breathing, their ribs hardly move at all, even if they don't have pain. But if you got pain, the reason why the rib's not moving and expanding the way it's designed to do so is because your body's protecting you. Survival. Your brain and your body will do what it has to. That's called a compensatory dysfunction. It'll do what it has to do. So no, you don't need core strengthening. You need motion through your ribs. And that doesn't mean I'm going to start rotating you, because not everybody can do rotation if they got back problems, But I will have you start breathing to start stretching out those intercostals using your diaphragm. I may have you do gentle motions, limited with breathing, to help open up those intercostals and your obliques to kind of stretch them out a little bit. So I need motion there, but what I really need to do is I need to get your stabilizers turned on. So spinal stabilization, we have to start with protecting, like I said, the spinal cord. So now don't worry about the first definition. That's kind of technical, but let's go right down here. Spinal stability is the spine's ability to maintain its structure and anatomical relationship with normal physiological loading. Normal physiological loading. So let's look that up. So let's go here. Physiological loading refers to the demands and stresses placed on the body's physiological systems during physical activity or exposure to external stimuli. So you have heart rate, perceived exertion, other physiological markers understanding and managing physiological load is crucial for optimizing performance, preventing injuries, promoting overall health. Now, physical activity is a load, so running, lifting weights, etc. But what I do is I measure other physiological external stimulus, which increases physical stress. Now, like I covered earlier, the lifestyle stuff. So when your stress load rating goes up, you have high emotional stress, you're not sleeping well, so your biochemical stress is up, you have nutritional factors going on. That's all playing a role on your physical stress, and that's moving you away from health or wellness and moving you into dis-ease, so your body's not at ease. Now, another thing we look at is how ready are you for exercise? And we're going to cover more about movement as medicine in part 5C. But as your rating goes up, you have a decreased tolerance for exercise. So we have to decrease your load. That's why stress number 1, 2, and 3 have to be mitigated right off the bat. Not 100%. Let's just start reducing those stressors. Let's develop a plan that you can execute over time, because let me ask you this. Did your injury happen overnight? Well, it's not going to recover overnight. But it isn't hard either. Just ask my clients. So here's the major misconception. Now we're going to move out of the 3 muscle imbalances. Now we moved into stable, core stability, stabilization, because we want to protect your spine. I find out you have pain, what's your spinal condition, what's your posture, what's your movement restrictions. The very first thing we want to do is we want to create infrastructure support. Protect that spine. And loosen the muscles that are tight and stabilize the muscles that are long and weak. Inner core stability dysfunction. Did you know that there are inner and outer core muscles? And in this image here, and this is something I have to explain all the time, it's really a shame that people have not learned about the misconceptions of their core. So your core goes from the top of your shoulders to just below your waist. And then you can see here in the image, it goes from the top of your shoulders down to your butt. So from the front, you got your pec muscles, your rectus abdominis, your obliques, and your deep hip flexors, your psoas muscles, your hip flexors. So look at your psoas. Here's your psoas here. Now look how it has an intimate relationship with your spine. So if you're coming to me and one hip is higher than the other, so the muscles on this side are short and tight because that hip is higher, short and tight, okay? And then you're rotated. So now the side that's forward, that psoas is short and tight and the other one's long and weak. I got to get rid of that rotation. And remember the flat back posture, my old posture? I needed to strengthen my psoas, both of them, but my left one more than the right. But in a lower cross syndrome, where the arch is excessive in the low back, we need to stretch and lengthen the psoas. In contrast to a flat back posture, that psoas needs to be strengthened and not lengthened. They need to lengthen their psoas to take that curve out of that position. Strengthening helps to increase the curve, hence the flat back. Lengthening helps to reduce the curve, but again, one side more than the other. What am I talking about here? Stabilization, core. This is part of your inner core. But to get back on point, what we're talking about here is stabilization. So the psoas, although it is a stabilizer for the spine because of where it's located, it has such an intimate relationship and has attachment points to the lumbar spine, it's also a mover. So it plays a dual role. When you use your body, one part of your body has to remain stable while the other part has to be mobile. What we have to do is we have to be able to stabilize and activate the inner core without the back moving. And that's where the psoas becomes more of a mover as well as a stabilizer. So I start teaching my clients how to integrate the use of their inner core while they're moving their leg, because in real life that's what's really going to happen. So again, it's that hip low back disassociation. So as she moves her leg, I want her back to stay in one position. I want her back to remain stable as she moves through that range of motion. I'm getting motion through the hip, but no motion through the back. So the body works in multiples. It's a force coupled relationship. There's mobility and stability happening simultaneously when you move. All right, then, so most people think the core is around the ribs or waistline of the body. However, it extends from the upper shoulders, upper core. So here's your upper core, here's your middle core, and then down here is your lower core. And if we go around to the back side of your body, then we got your shoulders and your trapezius muscles, and we have your lats, your big back muscles, you have your lower back, and you got your glutes. So you have the front side of the core and the back side of the core. So if you're going to throw a ball and you're going to run and you're going to climb, you do need core strength. I get it. But if you have an instability in your spine, your outer core is probably going to be over tight and imbalanced. So I'll find that one oblique will be shorter and tighter than the other because you'll be leaning to one side. Like I was leaning to my left and I was rotating forward. And that hip was back. No, that hip was forward, sorry. So I was corkscrewed. So I had to unwind that. That means I had to loosen that fascia. We talked about the fascia. Had to loosen that fascial line. Had to loosen that fascial line all the way up diagonally across the body from the front to back, and also the superficial lines in the front and back. So I need motion. You're tight. But again, why are we tight? Why? That's the $10,000 question. Brian, I do all these stretches, but I just can't seem to regain my flexibility or maintain it. I'll say, well, we have to find out why your muscles are tight. Stretching may not be enough. You might have some other things going on here. Outer core is your global movers, your gross movers. Remember, to run, to throw, to climb, to pull, to push. And then we have the infamous inner core. This is your gold right here. This is your major part of your investment. We come to the most important juncture of this talk, and that is a lack of segmental stability. Because if you do have joint pain, or in this case, lower back pain, I guarantee you that your inner core is probably not doing its job, which goes back to what I was saying earlier. If you're not assessing, you're guessing. So we have to get that inner core assessed to determine the level of dysfunction, what is its rating, and get it turned back on so it can do its job to protect and stabilize the spine. The inner core muscles are the primary stabilizers of the spine and include, but are not limited to, the diaphragm. We talked about the breathing muscle. The transverse abdominis. In this image down here, you can see it. You can see it in this image here. Look how big it is. Now, from the top down, if I were to chop my body in half, had a camera looking down into my trunk, here it is here. It crosses around the body like a corset, attaches to that multifidus, which is right next to the spinal column, And working with the multifidus, it acts as a stabilizer. But like I said, your body is sort of like a cylinder, right? And it encases it like a belt. And then when it turns on with the multifidus, you can see now the intraspinal stabilizers of the multifidus, which run from the lumbar spine all the way up to the cervical spine, creating spinal stability throughout the spinal column. Their primary job is to dissipate forces away from the spinal segments or away from joints. So if you fall or throw or lift or do something exerting against the anatomy, those stabilizers need to turn on so that the forces don't get absorbed by the joints and the spinal system themselves. And then your pelvic floor. Now, whether you're male or female, it doesn't matter. I need that pelvic floor to be activated at the bottom of that cylinder to create that intra-abdominal pressure to create stabilization to the spine. And there's a lot of reasons why that pelvic floor is not working. And a lot of you may already know what that means. If you have lower back pain, pain is what turns off these muscles. If your diaphragm, when I assess your diaphragm and you're breathing invertedly, remember how I was showing you how the upper spine talks to the lower spine? There's a neurological connection. That's why all these lines are connected here, from the top to the bottom or the bottom at the top. Your diaphragm is neurologically communicating with your transverse abdominis. Your transverse abdominis is neurologically communicating with your multifidi. And all of these are communicating with your pelvic floor. All right, so how many of you out there know that you can network computers together so that they can all communicate? That's what I'm talking about here. But let's say you come in and you want to network with your colleagues at work and you say, I can't, my computer's not networking with yours. Well, in that case, then you better call your IT guy because you need to get those computers networking together. Well, when these muscles aren't communicating, that's my job. I will reprogram and get the diaphragm talking with the transverse abdominis, which in then turn will talk to the multifidus and then the pelvic floor. And I don't do this alone. A good chiropractor will help this process by removing the nerve interference, but I'm literally reprogramming your muscles. And that's where I'm going to leave off today. But just to finish off, because I'll get into this whole how this thing communicates in part C, but this is your inner core. These are the muscles that are really going to support, stabilize, and protect your spinal cord. So, question I get from my clients, why is it turned off? Well, what happened before the injury? Was it turned off before the injury? Most likely. All right, so if you're a female, I'll ask you, how many kids do you have? And, well, I got 3 kids. I go, oh, good. How old are they? Oh, one's 15, one's 8, one's 6, or one's newly born or whatever, right? All right. Did you have them through natural childbirth or C-section? Natural. All right. Well, that trauma, the amount of pain, how long were you in labor with your first child? Some clients will tell me 36 hours, some will tell me 16. And I don't have to ask them if it was uncomfortable. So your brain, when it's under distress, will conserve energy. In this case, she had to pass a child through the birth canal. So she needed room. So she don't need her inner core to be activated. It needs to be deactivated. So pain and the process of birthing naturally does that. So then I ask her, did anybody show you how to turn that back on when you were done? And majority of the time, 99.9% of the time, no. I didn't know that they needed to, but I started going to Pilates, Brian, and I went back to and I'm not ditching on Pilates, don't get me wrong. They could have went back to their trainer. Okay? Well, what gets missed Right away we jump on the outer core right off the bat because I got to get I got to get my shape back after having my children. I get it. I had a lot of clients that had babies, but I worked on their inner core first, turned it back on. Now, if you had a C-section, I had an inguinal hernia surgery. Back in my day, it was not arthroscopic, so they lacerated a nice line through my inguinal area and they went in and fixed my hernia. Another reason I had back problems. Another story for another day. Anytime you cut through the abdominal wall, you cut through those muscles. Remember, I said if you crimped your Ethernet, or if you splinter it until you fix it, you might get a half-hearted transmission or you might get none at all. Or crimping the hose of a water hose stops the flow of water. So they cut through that. Now you got scar tissue and the muscles are turned off and the pelvic floor is turned off. And I checked your breathing, and because you were having a child, which is a beautiful experience, but yet traumatic, the diaphragm is stoved up. That's just one example. Now, another example. Why is what happened before? So I get a little health history. I find out you had a fall before, you were in an accident, some other kind of trauma. That will turn it off. And then you'll splinter because your body goes into protection. And then another example would be if I'm doing lifestyle and I find out you got constipation, diarrhea, indigestion, or you just tell me I have irritable bowel syndrome. Well, that's going to inhibit it because that's a visceral response. And that goes back to this image. So now I got a visceral response. That's turning off the inner core. Inhibition. So where we leave off today is, let's do a quick review. We looked at imbalances. Which one are you? So you have to have something that's specifically designed. Okay, movement and ending in poor posture. We have to have ideal posture when we're moving. That's the long run. What's your dream, right? What do you want to get back to? Want to be able to pick up my kids every day? I got to get in and out of a chair, in and out of a car, but I do want to get back to tennis. These are examples. Do you have a spinal condition? And this is an eye-opener for people. Oh, I don't have back pain, but yet I got to check you out because I don't want you to have a herniated disc or a full herniated disc. You may have a grade 1 or 2. All right. What's the difference between core strength, core stability? What do you need first? Do you need more core stability at the beginning of your journey with exercise or more core strength? Stability. Stability and mobility. Then we'll get to the core strength. Isolate, then integrate. Stabilization, physiological load, difference between the outer core, look how big it is, as above, so below, and then your inner core. All right, thoroughly enjoyed doing this, and I always enjoy teaching, and again, my motto, empowering people with knowledge. All right, so where we're going to go from there, we'll do a little recap on the inner core because that's a little tough area. And then we'll move out of that. And then we talk a little bit about like a phase 1 perspective of corrective therapeutic exercise. What do you do? Because exercise is like medicine. Are you doing exercises that are outside the parameters that you need for your body? All right. I enjoyed this. I hope you enjoyed it. Leave comments, please. If you want to contact me, contact information will follow this. This is for everyone who has pain, but there's a lot of answers to your questions. Boy, this whole simplistic, quick fix, one-trick pony approach to pain, that ain't going to work. Don't see a symptomatologist. Get long-term symptomatic release and see a holistic practitioner. I'm Brian Schwager. Have a beautiful day. Stay empowered. Watch for part 5C coming up next. Bye for now.